Every year, more than 795,000 people in the United States have a stroke, and 1 in 6 deaths from cardiovascular disease is actually due to stroke.
And to make things worse, latest CDC data shows stroke rates are rising, especially among young people. The rate of stroke for people 18 to 44 years old increased by 15% between 2011 and 2022. To help us sort it all out, we've invited Dr. Yaser Badr, a neurosurgeon with Dignity Health Glendale Memorial Hospital's Comprehensive Stroke Center. And also joining us today is stroke survivor Nick Reed. Good to see both of you.
Thank you.
Thank you.
Yeah, thanks for joining us. An important topic to talk about. Nick, you've experienced this firsthand. Tell us what happened with you, like what age were you, and then what happened in the following days?
Sure. I'm 38 years old right now, so it was a year ago on July 17th. I turned 39 on July 13th. And I was golfing with some buddies. It was a summer day up in Sylmar at Hanson Dam Golf Course.
Yep.
Doing what we do regularly, and started getting tunnel vision on hole 1. Hole 2, started getting a little more tunnel vision. Thought I was dehydrated. It was a hot day, so I started drinking a lot of water. And I got to hole 4 or 5, one of those holes, and it was a par 3. Hit a great shot off the tee box, almost made it in, and then I passed out. And then from there, was rushed to the clubhouse, and I couldn't walk into the clubhouse. I could not function. I was too dizzy. My coordination was messed up, and I crawled in to the clubhouse. And then from there, 911 was called. Wow. Yeah, it was wild.
Yet you still remember what you shot on that last hole.
That was almost in.
Of course he does.
All right, Dr. Badr, every 40 seconds, someone in the United States has a stroke. Every 3 minutes, someone actually dies from a stroke. Start with the symptoms, and what would she be looking for, which he may have sort of answered that, I guess.
Sometimes the stroke can be very clear. Like you can have symptoms that everybody would know, like weakness on one side of the body, difficulty talking. And sometimes the stroke comes in symptoms that's not very clear. Like he had symptoms like of dizziness, disorientation, the room was spinning, and that sometimes can be very weird. A stroke that happens in somebody that young is also very unusual to happen.
Let's talk about the causes, and then are there different types of strokes?
There's definitely different types of strokes. There's strokes that happen because there's a blood clot that goes to the brain, blocks one of the blood vessels, and results in some area of the brain that's not getting blood supply, and that area of the brain dies. Now, modern medicine and the advances has been happening in the last 20 years allow us as a physician or medical centers to be able to treat strokes. When somebody had a stroke in the 80s and the 90s, that's too bad. Let's do something to prevent you from having more strokes, but the stroke that happened is irreversible. Now, if the stroke is caught within certain time frame, then actually be reversible, that you can go home when you leave the hospital without a stroke.
What is that time frame? Is it like 20 minutes or 2 hours? Or?
It's variable, depends where the stroke happens or the location of the stroke, but it can be up to 4 hours, 12 hours in some strokes, sometimes even longer, 24 hours if it was caught in time.
So a stroke is the leading cause of serious long-term disability. So if you're a survivor of that, what can you expect?
Depends on where the stroke happened, depends on what the disability that happened, but what we're trying to do is to prevent the stroke from happening in the first place. If the stroke happened, then we try to improve the chance of the rest of the brain, the surviving brain, to recover, to be able to restore the function for the individual to be able to restore his life and go back to normal.
All right, and of course, a lot of people thinking, like, Nick, you never thought that you were going to have a stroke, especially at your age. What can we do? There's so many things that we work so hard at to stay healthy.
So there's really no screening to predict, am I going to have a stroke or not, even older or younger. All we can do is to prevent that, risk modification, we call it. Exercise, diet, not smoking. It's almost the same as when you're driving. You can take all the measures to have a safe drive, but at some point you can get in an accident when things happen that you have no role in it. So the same thing with stroke is to able to optimize your body, your health, to prevent it. And if a stroke happens, I think the main thing is that advances that happen in medicine is that you get to a place or a hospital a location when we call it a comprehensive stroke center, meaning they have highly trained physicians to be able to handle, from the emergency room doctor to neurologists to neurosurgeons, to be able to handle whatever type of stroke that happened and can get you out of this, hopefully, very safe.
Nick,
back to your family.
To look at you, to see you, doesn't look like you ever had a stroke. How are you doing? Is anything different in your life?
Yeah, there's stuff different. My coordination is off, dizziness real bad all the time, and then not able to do the things I normally would do, obviously, before this. Fatigue is no doubt real, and so, but I'm alive. I'm getting around and trusting it's going to get better.
And are those some of the normal post?
If the stroke has already established, which in his situation, by the time that he actually got to a place where they can take care of a stroke was a long time that the stroke already established, what we call it. The stroke already happened. There's some damage happened in the brain. So he has what we call leftovers after extensive recovery of the stroke that happened. But our goal in medicine, especially in Los Angeles, is that we have trained a lot of the hospitals, a lot of the places, highly trained physicians to be able to prevent him from that. Like when you have a stroke, the same as you have a heart attack now, you can go to the hospital, they have catheters, they can open your blood vessels. The same thing we can do for the brain. So when you leave the hospital and 2 to 3 days later or a week later, you don't have a stroke. You don't have any stroke symptoms.
Well, thank you for sharing your story, Nick. It's an important one.
All right, for more information on Dr. Badr, you can log on to Sierra Neuroscience Institute.org. They ran all those words together. Or check out Dignity Health Glendale Memorial Hospital's website at dignityhealth.org. And Nick, he's got a wife and 4 beautiful girls over there, so you need to be around for a long time.
Hi, Rachel. Rachel and the daughters. Wow, amazing. Thanks for joining us today. We appreciate it.
Thank you.
Thank you.
Everybody.
Thank you.
Happy summer to the girls.